The Case of Scientific Fraud in Cardiovascular Medicine, a Critical Examination. Introduction. In the annals of medical science, few scandals have had such profound implications as the fraudulent research surrounding the use of beta blockers before surgery. This case not only highlights the vulnerabilities within the scientific community but also underscores the catastrophic consequences that can arise from the misuse of data. The following report delves into the timeline, the impacts, and the responses that emerged from this egregious breach of scientific integrity. Background. Beta blockers are a class of medications commonly prescribed to manage various cardiovascular conditions. They work by blocking the effects of adrenaline on the heart, reducing heart rate and blood pressure, which is beneficial in many clinical settings. Prior to the scandal, there was ongoing debate regarding the appropriateness of administering beta blockers to patients undergoing surgery, particularly cardiac surgery. The fraudulent study. The controversy began when a prominent cardiologist published a study claiming that beta blockers significantly improved patient outcomes when administered before surgery. The results indicated lower rates of complications and mortality in patients who received these medications compared to those who did not. This research was based on falsified data that the cardiologist manipulated to produce favorable outcomes. Changes to medical guidelines. The publication of these findings drew immediate attention and led to a rapid shift in medical guidelines across Europe. Health authorities eager to adopt practices that promised better patient outcomes revised their recommendations to endorse the use of beta blockers as a standard preoperative treatment. This change resulted in widespread implementation across hospitals, affecting thousands of patients undergoing surgical procedures. The unraveling of the fraud. As time passed, discrepancies in the data began to surface. Independent researchers and medical professionals started questioning the validity of the study's results. Subsequent investigations revealed that beta blockers did not improve outcomes as claimed. Instead, they increased the risk of death by approximately 27%. This shocking revelation prompted a re-evaluation of the guidelines that had been hastily adopted based on fraudulent evidence. Impact on patient safety. The repercussions of this scandal were dire. Estimates suggest that the reliance on beta blockers driven by the fraudulent study may have contributed to the deaths of up to 800,000 patients. The implications of this research extended beyond individual cases, impacting public trust in medical research and healthcare systems. Public and professional outcry. The fallout from the scandal elicited a significant response from both the medical community and the public. There was widespread outrage over the breach of trust and the apparent lack of accountability. Health professionals called for stricter regulations on research practices and more rigorous peer review processes to ensure that such fraud would not be permitted to occur again. Calls for reform. In the wake of this scandal, numerous initiatives began to emerge aimed at strengthening the integrity of medical research. One notable initiative was the Medical Evidence Project led by James Heathers, which aimed to identify and rectify poor quality medical evidence before it could lead to adverse patient outcomes. The project underscored a growing awareness within the medical community about the importance of scrutinizing clinical data and enhancing transparency in research practices. Lessons learned. This heartbreaking case serves as a poignant reminder of the potential dangers associated with scientific fraud. It emphasizes the critical need for vigilance and integrity in medical research. The reliance on falsified data can have catastrophic consequences not only for individual patients but for the healthcare system as a whole. The incident has catalyzed discussions about the need for reform and how medical evidence is evaluated, with calls for more rigorous oversight and accountability. Conclusion. The fraudulent study on beta blockers represents one of the most significant breaches of trust in the medical field, with far-reaching consequences that continue to resonate today. It serves as a stark reminder of the essential role that integrity and transparency play in scientific research. Moving forward, it is imperative that the medical community remains vigilant and committed to safeguarding patients' safety through rigorous evaluation of research methodologies and findings. The lessons learned from this case must inform future practices to prevent similar tragedies from occurring and to restore public confidence in medical science. The case of the cardiologist who falsified data regarding beta blockers serves as a pivotal example of the catastrophic consequences that can arise from scientific fraud in medical research. The implications of this incident extend far beyond the immediate effects on patient outcomes, raising profound questions about the integrity of scientific practices, the nature of medical guidelines, and the systems in place to safeguard public health. Counterintuitive information. 1. Misguided trust in research. A counterintuitive aspect of this case is the inherent trust placed in medical research by both practitioners and regulatory bodies. The fraudulent findings led to a widespread recommendation for a treatment that ultimately increased mortality risk. It challenges the assumption that peer-reviewed studies, especially those that influence guidelines, are always reliable and trustworthy. 2. Delayed recognition of harm. Another surprising element is the timeline of recognition regarding the harmful effects of beta blockers. Despite the severe implications of the study, it took time for the medical community to uncover the fraud and acknowledge the increased risk associated with beta blockers. This lag in recognizing the truth illustrates a systemic vulnerability in the medical research process, wherein the fallout from flawed studies can take years to fully understand. 3. Scale of impact. The estimate that up to 800,000 patients may have suffered fatal consequences due to reliance on the fraudulent data starkly contrasts with the more typical perception of research misconduct as being isolated or affecting only a small cohort of individuals. This case exemplifies how a single fraudulent study can have widespread repercussions affecting hundreds of thousands of lives, challenging the notion that scientific fraud is a minor issue. 4. Reform initiatives triggered by scandal. The response to this fraud included initiatives like the Medical Evidence Project, aimed at preventing poor quality medical evidence from causing harm. This proactive approach is counterintuitive because it suggests that rather than simply punishing the offenders, the medical community is focusing on systemic reform and prevention, indicating a shift towards a more self-regulating mechanism in scientific inquiry. 5. Over-reliance on quantitative metrics. The reliance on quantitative outcomes in the study, i.e., statistical improvement in surgical outcomes without sufficient qualitative analysis or scrutiny, raises questions about the methodologies employed in medical research. It highlights the potential dangers of valuing numbers over comprehensive patient care assessments, suggesting that a focus on data alone can lead to misleading conclusions about treatment efficacy. 6. Emphasis on rigorous scrutiny post-fraud. The scandal has catalyzed discussions about the need for more rigorous evaluation of clinical data, which may seem counterintuitive in a field that already has established protocols for review. The reality is that existing systems may not be sufficient to catch fraudulent behavior, necessitating an overhaul in how medical evidence is assessed and validated. 7. Psychological mechanisms of acceptance. The willingness of the medical community and regulatory bodies to accept the initial findings without sufficient skepticism reflects cognitive biases in scientific inquiry. This highlights how deeply held beliefs and the desire for positive outcomes can cloud judgment, leading to the acceptance of flawed research. Conclusion. The case of the cardiologist who manipulated data to support the use of beta blockers underscores the critical need for vigilance in scientific research. The counterintuitive lessons learned from this incident serve as a cautionary tale about the potential for widespread harm stemming from a single act of fraud. It emphasizes the importance of enhancing the mechanisms for verifying the integrity of medical research and the necessity of fostering a culture of accountability within the scientific community. As the medical field continues to grapple with the repercussions of this scandal, the focus must remain on safeguarding patient health through improved evidence evaluation and reforming the structures that govern medical guidelines. The case of scientific fraud involving the manipulation of data regarding beta blockers has profound implications that extend beyond the immediate medical community, touching on ethics in research, patient safety, and the integrity of medical guidelines. While many people may focus primarily on the outcome, namely the increased mortality risk associated with beta blockers, the underlying nuances of how such fraud was able to influence widespread clinical practice are often overlooked. Here I will highlight and explain several critical aspects of the report that merit closer examination. 1. The mechanism of influence. One of the most significant elements of this fraud is the mechanism by which the fraudulent data was able to influence European medical guidelines. The cardiologist's research purported to show that beta blockers improved surgical outcomes, a claim that was compelling enough to prompt immediate changes in practice. This highlights a critical vulnerability in the medical establishment: the reliance on published research to shape clinical guidelines without sufficient scrutiny of the underlying data. Significance: it underscores the necessity for a more robust verification process within the scientific community, where research is not merely accepted at face value but subjected to rigorous peer review and reproducibility tests. The implications are far-reaching. A culture of uncritical acceptance of research findings can lead to widespread adoption of harmful practices. 2. The scale of impact. The report mentions that the misuse of beta blockers could have led to the deaths of up to 800,000 patients. This staggering figure not only reflects the direct consequences of the fraudulent data but also the systemic failures in the medical community that allowed such a situation to arise. Significance: the potential loss of life on such a scale serves as a wake-up call regarding the broader implications of research integrity. It signals that scientific misconduct can have catastrophic outcomes, emphasizing the importance of accountability and transparency in medical research. This case can serve as a pivotal example in discussions about the need for reform and how clinical evidence is evaluated and utilized. 3. The role of advocacy and reform movements. In the aftermath of this scandal, initiatives like the Medical Evidence Project led by James Heathers emerged. These movements aim to identify and rectify poor quality medical evidence before it can cause harm. This proactive approach reflects a growing awareness within the medical community about the consequences of scientific fraud and the need for systemic change. Significance: the establishment of reform movements is crucial for fostering a culture of scrutiny and accountability. It signals a shift toward prioritizing patient safety and ethical standards over the rapid dissemination of potentially flawed findings. Such advocacy efforts are essential in building a resilient system that can withstand the pressures of scientific misconduct. 4. Ethical considerations in research. The fraudulent actions of the cardiologist raise deep ethical questions about the responsibilities of researchers. The desire to produce favorable outcomes can lead to a slippery slope where data is manipulated to fit a narrative, undermining the fundamental principles of scientific inquiry. Significance: this case highlights the need for a strong ethical framework in research. Institutions must prioritize ethics training for researchers and establish clear consequences for misconduct. It serves as a reminder that the integrity of research is not only a professional obligation but a moral imperative that has real-world consequences for patient health and safety. 5. The psychological and social dynamics at play. Understanding the psychological and social dynamics that may lead a researcher to commit fraud is crucial. Factors such as career pressures, the competitive nature of academia, and the desire for recognition can create an environment where unethical behavior is more likely to occur. Significance: recognizing these dynamics is essential for preventing future incidents of fraud. By addressing the root causes, such as high-stakes evaluations and the pressure to publish, institutions can create a more supportive environment that encourages integrity and accountability. 6. The importance of public trust. The fallout from this scandal extends to the public's trust in medical research and healthcare providers. When a significant breach of trust occurs, it can lead to skepticism about medical guidelines and treatments, potentially harming patient-provider relationships. Significance: restoring public trust is a complex challenge that requires transparency and communication from both researchers and healthcare professionals. Engaging the public in discussions about the integrity of research and the measures being taken to prevent fraud is essential for rebuilding confidence in medical science. 7. The need for ongoing scrutiny. Finally, the report indicates that there is an ongoing need for scrutiny of medical evidence. The presence of initiatives like the Medical Evidence Project suggests that there is an acknowledgement that the landscape of medical research is fraught with challenges that require continuous vigilance. Significance: establishing a culture of continuous evaluation and improvement in medical research practices is vital. This means not only addressing past misconduct but also proactively identifying areas where evidence may be lacking or flawed. It emphasizes the importance of a dynamic approach to medical guidelines that can adapt as new information becomes available. Conclusion: the case of fraudulent research surrounding beta blockers is a powerful reminder of the inherent vulnerabilities within the medical research community. By examining the overlooked aspects of this scandal, ranging from the mechanisms of influence to the ethical responsibilities of researchers, one can appreciate the profound implications for patient safety, public trust, and the integrity of scientific inquiry. Addressing these issues is not merely about preventing future fraud but is essential for fostering a medical landscape that prioritizes transparency, accountability, and the well-being of patients. The case of scientific fraud involving a cardiologist who falsified data regarding the efficacy of beta blockers before surgery is a profound example of how misinformation can have catastrophic consequences in the medical field. Here are the 4 most valuable points that warrant in-depth analysis and discussion. 1. Fraudulent research and its immediate impact. The initial act of fraud by the cardiologist, which claimed that beta blockers led to improved surgical outcomes, set off a chain reaction within the medical community. The research was accepted and acted upon, leading to a significant alteration in European medical guidelines that recommended the use of beta blockers for patients undergoing surgery. This point underscores the vulnerability of the healthcare system to fraudulent research, particularly when it comes from a seemingly credible source. The implications of this fraud are multifaceted, as it not only misled practitioners but also eroded trust in medical research. The acceptance of this flawed data highlights the importance of rigorous peer review and the need for skepticism regarding new findings, especially those that could significantly alter clinical practice. 2. Consequences of the fraud, the human cost. The realization that beta blockers could increase the risk of death by 27% is a staggering consequence of this fraud. The estimate that up to 800,000 patients may have died as a result of relying on this misinformation showcases the severe human cost of scientific misconduct. This point raises critical ethical questions about accountability in medical research and the responsibility of researchers to ensure the integrity of their findings. It also brings to light the potential for harm that can arise when medical guidelines are influenced by false data, affecting countless lives and leading to a public health crisis. The discussion around these consequences should focus on how to better protect patients and ensure that research is both ethically conducted and transparently reported. 3. Public and professional response to scientific misconduct. The widespread outrage following the discovery of the fraud reflects a significant public and professional response to the crisis. It has prompted discussions about the integrity of medical research and the systems in place to prevent such misconduct in the future. This point emphasizes the necessity for reform within the medical research community, including the implementation of more stringent checks and balances to ensure data integrity. The response also highlights the role of professional societies and regulatory bodies in maintaining ethical standards in research. Engaging the medical community and the public in these discussions is crucial for rebuilding trust and ensuring that similar incidents do not occur in the future. For Advocacy for Better Medical Evidence, the role of initiatives. In the aftermath of this scandal, initiatives like the Medical Evidence Project spearheaded by James Heathers have emerged. These initiatives aim to proactively identify and correct poor quality medical evidence before it can cause harm. This point is vital as it represents a shift towards a more proactive approach in safeguarding the integrity of medical evidence and enhancing patient safety. The Advocacy for Better Evidence underscores a growing recognition within the medical community of the need for rigorous methodologies in research and the importance of transparency in data reporting. The establishment and support of such initiatives are essential for fostering a culture of accountability and continuous improvement in medical research practices. Conclusion. The case of the cardiologist's fraudulent research on beta blockers serves as a cautionary tale about the potential dangers of scientific misconduct in the medical field. The implications of this fraud extend beyond immediate patient outcomes to encompass broader ethical considerations, systemic vulnerabilities, and the necessity for robust advocacy for quality medical evidence. By examining these points, the medical community can work towards developing stronger safeguards against fraud and ensuring that patient care is based on reliable and ethically sound research. Here are 3 famous historical cases of scientific fraud that bear similarities to the case of the cardiologist who faked data on beta blockers. 1. Andrew Wakefield and the MMR vaccine study 1998. In 1998, Andrew Wakefield published a study in the medical journal The Lancet suggesting a link between the MMR measles, mumps, and rubella vaccine and autism. Wakefield's research was based on a small sample size of only 12 children and was riddled with ethical violations and undisclosed financial conflicts of interest. The study sparked a massive public health scare and led to a significant decline in vaccination rates, resulting in outbreaks of measles and mumps. Subsequent investigations found that Wakefield had manipulated the data, and in 2010 The Lancet fully retracted the study. Wakefield lost his medical license due to his unethical practices, and the case remains one of the most notorious examples of scientific fraud with ongoing repercussions for public health. 2. Paolo Macchiarini and the synthetic trachea implants. Paolo Macchiarini, an Italian surgeon and researcher, gained fame for his work on synthetic trachea transplants. He claimed to have successfully implanted synthetic tracheas made from plastic and stem cells in patients. However, investigations revealed that Macchiarini had misrepresented the outcomes of his surgeries and that many patients suffered severe complications or died as a result of the procedures. Reports of his unethical behavior in conducting surgeries without proper consent, as well as falsifying data about patient outcomes, led to a significant scandal in the medical community. Macchiarini's actions raised questions about the oversight of clinical research and the ethical responsibilities of surgeons, resulting in his dismissal from positions and ongoing investigations. 3. Diederik Stapel and social psychology research. Diederik Stapel, a Dutch social psychologist, was found to have committed extensive fraud in his research, fabricating data for dozens of published studies over a span of years. His bogus research often focused on topics like consumer behavior and social perception, leading to influential publications in top-tier journals. The fraud was uncovered in 2011, prompting a thorough investigation that revealed Stapel's manipulation of data and the lack of proper oversight in research practices. His actions led to a re-evaluation of standards in social psychology and sparked debates about the reliability of published research. Stapel ultimately faced academic consequences, including the retraction of many of his papers. And the case highlighted the need for increased scrutiny and transparency in scientific research. These cases illustrate the potentially devastating effects of scientific fraud not only on the integrity of research but also on public health and trust in medical practices. Each of these instances prompted significant discussions about the need for stringent ethical standards and oversight in scientific research. The case of scientific fraud involving a cardiologist who faked data regarding the efficacy of beta blockers before surgery serves as a harrowing reminder of the potential consequences of unethical practices in medical research. As we look toward the future, several predictions can be made regarding the implications of this incident and the broader field of medical research. 1. Increased scrutiny and regulation. In the wake of this scandal, we can expect a significant increase in scrutiny of clinical research. Regulatory bodies will likely implement stricter guidelines for the approval of medical studies, particularly those that could affect public health on a large scale. Enhanced transparency in clinical trials, including mandatory data sharing and independent reviews, may become the norm to ensure integrity and accuracy in research outcomes. 2. Adoption of advanced technologies. The future will likely see the integration of advanced technologies such as artificial intelligence and blockchain in clinical research to enhance data integrity. AI can help identify anomalies in data patterns that may suggest fraud, while blockchain technology can provide a secure and immutable record of research data, making it more difficult to manipulate results without detection. 3. Shift toward evidence-based practices. There will be a stronger push toward evidence-based practices in medicine. As awareness of the ramifications of relying on flawed studies grows, healthcare providers and policymakers will prioritize high-quality evidence. This may lead to the establishment of more rigorous criteria for the inclusion of studies in clinical guidelines, ensuring that recommendations are grounded in reliable data. 4. Emergence of new advocacy groups. Following the fallout from this case, we can anticipate the emergence of new advocacy groups dedicated to improving the standards of medical research. These organizations will focus on educating both the public and professionals about the importance of critically evaluating medical evidence and advocating for systemic changes within research institutions. 5. Enhanced education and training. Medical education will likely evolve to emphasize the importance of research ethics and integrity. Future healthcare professionals will receive more comprehensive training on how to critically appraise scientific literature and understand the implications of fraud in research. This educational approach will foster a culture of accountability and ethical standards in the medical community. 6. Changes in publishing practices. The academic publishing industry may undergo significant changes in response to the demand for greater accountability. Journals might adopt stricter peer review processes, and there could be a rise in the use of preprints, allowing for earlier dissemination of research findings while still maintaining rigorous evaluation standards. This shift could help identify potential issues with studies before they influence clinical practice. 7. Long-term impact on patient trust. The long-term impact of this scandal on patient trust in the medical community cannot be overstated. As patients become more aware of the potential for scientific fraud, they may approach medical advice with increased skepticism. This could lead to a demand for more transparent communication from healthcare providers about the evidence supporting treatment recommendations, fostering a more collaborative patient-provider relationship. 8. A global movement for research integrity. The implications of this case may resonate beyond Europe, catalyzing a global movement for research integrity. International collaborations may form to establish and enforce standards for ethical research practices worldwide, promoting a unified approach to preventing fraud and ensuring patient safety across borders. Conclusion. The future of medical research will be shaped significantly by the lessons learned from this case of scientific fraud. Increased scrutiny, the adoption of advanced technologies, a shift toward evidence-based practices, and a commitment to integrity in research are all likely outcomes. As the medical community strives to rebuild trust with patients and stakeholders, the emphasis will be on fostering a culture of ethical conduct that prioritizes patient safety above all else. The hope is that through these efforts we can prevent similar tragedies from occurring in the future.